Question 1. A patient complains of a burning sensation and swelling at their arteriovenous fistula, AVF, site immediately after cannulation. The skin around the needle site appears red and warm. Which of the following is the most appropriate initial action for the dialysis technician? A. Apply a warm compress to the site. B. Administer an analgesic as per protocol. C. Discontinue the current cannulation and recannulate in a new site. D. Elevate the extremity and continue with treatment. Answer: C. Discontinue the current cannulation and recannulate in a new site. This question focuses on managing immediate complications during AVF cannulation, and the keywords burning sensation, swelling, red and warm suggest a potential infiltration or hematoma, which requires immediate attention. If a patient experiences these symptoms after cannulation, it indicates that the needle may have gone through the vessel or is not properly seated, causing blood to leak into the surrounding tissues. The most appropriate action is to remove the needle and select a new site to prevent further injury and ensure effective dialysis. Continuing with treatment or applying compresses without addressing the underlying issue could worsen the infiltration. Remember, always prioritize patient safety and effective access when complications arise. Question 2. During a hemodialysis treatment, the arterial pressure alarm repeatedly sounds with readings becoming more negative, e.g., minus 250 millimeters of mercury. The patient denies any pain or discomfort at the access site. What is the most likely cause of this alarm? A. Venous needle infiltration. B. Kink in the arterial bloodline. C. Hemolysis of red blood cells. D. Increase in blood flow rate. Answer: B. Kink in the arterial bloodline. This question tests your troubleshooting skills related to dialysis machine alarms, specifically an arterial pressure alarm with more negative readings and the patient feeling no pain as key clues. A more negative arterial pressure, especially without access site pain, typically indicates an issue before the pump that is impeding blood flow from the patient, such as a kink or clamp in the arterial bloodline, or a spasm in the access vessel. This increased suction is the machine trying to pull blood against resistance. An infiltration would likely cause pain and swelling. Hemolysis is a consequence of severe issues, and an increased blood flow rate would generally increase pressure, not make it more negative. Always check the bloodline for kinks or clamps first when you see increasingly negative arterial pressures. Question 3. A patient's prescribed Dialysate conductivity range is 13.5 to 14.5 ms/cm. The machine's alarm continuously sounds, indicating a conductivity of 12.8 ms/cm. What is the immediate risk to the patient if treatment continues with this conductivity? A. Hypernatremia. B. Hemolysis. C. Hyponatremia. D. Air embolism. Answer: C. Hyponatremia. This question assesses your understanding of dialysate composition and its impact on patient safety, with conductivity of 12.8 ms/cm, lower than prescribed D, as the critical piece of information. Dialysate with a conductivity lower than prescribed means there are fewer solutes, particularly sodium, than intended. If a patient is dialyzed with hypotonic, low solute, dialysate, water will move from the dialysate into the patient's blood due to osmosis, potentially leading to hyponatremia, which is a dangerously low sodium level in the blood. This can cause fluid shifts into cells, resulting in symptoms like confusion, seizures, and cerebral edema. Hemolysis is typically caused by highly hypotonic dialysate or extremely low conductivity, or very high conductivity, hypertonic dialysate. Remember, always ensure the dialysate conductivity is within the prescribed range to prevent dangerous electrolyte imbalances. Question 4. Which of the following components of the water treatment system is responsible for removing chloramines? A. Sediment filter. B. Carbon tanks. C. Water softener. D. Reverse osmosis, RO, membrane. Answer, B. Carbon tanks. This question tests your knowledge of the vital water treatment process in dialysis, specifically identifying the component that removes chloramines. Chloramines are disinfectants added to municipal water and are toxic to dialysis patients because they can cause hemolytic anemia. The carbon tanks, specifically granular activated carbon, GACI, are designed to remove chloramines through adsorption, a process where the chemicals stick to the surface of the carbon. Sediment filters remove larger particles, water softeners remove calcium and magnesium, hard water minerals, and the RO membrane removes a large percentage of contaminants including bacteria, viruses, and endotoxins, but carbon is the primary defense against chloramines. Always ensure carbon tanks are properly functioning and regularly tested to protect patients from harmful disinfectants. Question 5. A patient on hemodialysis has developed carpal tunnel syndrome in their access arm. What type of vascular access are they most likely using? A. Central venous catheter, CVC. B. Arteriovenous fistula, AVF. C. Arteriovenous graft, AVG. D. Peritoneal dialysis catheter. Answer, B. Arteriovenous fistula, AVF. This question assesses your knowledge of complications related to specific vascular access types, with carpal tunnel syndrome and access arm being the key clues. Carpal tunnel syndrome, characterized by pain, tingling, and numbness in the hand, is a known potential complication of an arteriovenous fistula, AVF. This occurs because the increased blood flow through the fistula can lead to venous hypertension in the hand and wrist, compressing the median nerve. While other access types have their own complications, carpal tunnel syndrome is specifically associated with the hemodynamic changes caused by an AVF. Remembering common complications unique to each access type helps you better understand and care for your patients. Question 6. Prior to initiating dialysis, a patient's pretreatment weight is 72 kilograms, and their prescribed dry weight is 68 kilograms. The prime and rinseback volume for the dialyzer and bloodlines is 250 milliliters. How much total fluid needs to be removed from the patient during the treatment? A. 4, 25 kg. B. 4, 0 kg. C. 3, 75 kg. D. 4, 5 kg. Answer. A. 4, 25 kg. This question tests your ability to calculate the total fluid removal goal, which is a critical skill for every dialysis technician, with pretreatment weight, dry weight, and prime and rinseback volume as the essential numbers. To determine the total fluid to remove, you must first calculate the weight difference between the pretreatment weight and the dry weight. 72 kg, 68 kilograms equals 4 kilograms. Then, you must account for the fluid that will be returned to the patient during rinseback, which is the volume of the dialyzer and bloodlines, 250 ml or 0, 25 kg, since 1 kilogram equals 1 liter. Adding these together, for kg plus 0, 25 kg, gives a total fluid removal goal of 4, 25 kg. Always remember to add the rinseback volume to the weight difference to ensure the patient reaches their true dry weight. Question 7. A new dialysis patient with a history of heart failure is scheduled for their first treatment. Which of the following parameters should the technician monitor most closely during the initial hours of dialysis? A. White blood cell count. B. Blood pressure and heart rate. C. Potassium levels. D. Blood glucose levels. Answer B. Blood pressure and heart rate. This question assesses your understanding of critical patient monitoring, especially for vulnerable new patients with a history like heart failure, with monitor most closely during the initial hours as the key time frame. Patients with heart failure are particularly susceptible to fluid shifts and hemodynamic instability during dialysis, making close monitoring of their blood pressure and heart rate paramount. Rapid fluid removal can lead to hypotension, low blood pressure, and potential cardiac complications, while the body's response can also elevate heart rate. While other parameters are important, maintaining cardiovascular stability is the most immediate concern. Always prioritize hemodynamic stability, especially during a patient's first few treatments. Question 8. What is the primary purpose of heparin administration during hemodialysis? A. To prevent infection. B. To increase blood pressure. C. To prevent clotting in the extracorporeal circuit. D. To stimulate red blood cell production. Answer C. To prevent clotting in the extracorporeal circuit. This question evaluates your understanding of common medications used in dialysis, specifically the primary purpose of heparin. Heparin is an anticoagulant, meaning it is given to prevent blood from clotting. During hemodialysis, blood is continuously circulated outside the body through the extracorporeal circuit, dialyzer and bloodlines, which is a foreign surface where blood naturally tends to clot. Heparin ensures that the blood remains fluid, allowing for an uninterrupted and effective treatment. It does not prevent infection, increase blood pressure, or stimulate red blood cell production. Remember that heparin is crucial for maintaining the patency of the dialysis circuit. Question 9. A patient's post-dialysis laboratory results show a significantly elevated potassium level, hyperkalemia, despite adequate dialysis time and blood flow. What immediate dialysate modification might be considered to address this? A. Increase the sodium concentration. B. Decrease the bicarbonate concentration. C. Use a lower potassium dialysate bath. D. Increase the calcium concentration. Answer C. Use a lower potassium dialysate bath. This question tests your knowledge of dialysate adjustments for electrolyte imbalances, specifically addressing elevated potassium level, hyperkalemia, and asking for an immediate dialysate modification. The most direct way to remove more potassium during dialysis is to decrease the potassium concentration in the dialysate. By creating a larger concentration gradient between the patient's blood and the dialysate, more potassium will diffuse from the patient's blood into the dialysate and be removed. Increasing sodium or calcium, or decreasing bicarbonate, would address other electrolyte or acid-base issues, not specifically hyperkalemia. Always remember that adjusting the dialysate bath's electrolyte levels is a key strategy for managing specific electrolyte imbalances in dialysis patients. Question 10. Which of the following is the most common cause of air embolism during hemodialysis? A. Rapid intravenous fluid administration. B. Inadequate heparinization. C. Loose connections in the extracorporeal circuit. D. Patient coughing forcefully. Answer C. Loose connections in the extracorporeal circuit. This question focuses on a severe and potentially fatal complication in dialysis, an air embolism, and asks for the most common cause. Air embolism occurs when air enters the patient's bloodstream. While several factors can contribute, loose connections in the extracorporeal circuit, particularly on the arterial side before the blood pump or venous side after the blood pump, are the most frequent culprits. These loose connections can allow air to be entrained into the blood path. Inadequate heparinization causes clotting, not air entry. Always double-check all connections in the circuit before and during treatment to prevent this dangerous complication. Question 11. What is the primary reason for performing a fistula thrill assessment prior to each hemodialysis treatment? A. To identify signs of infection. B. To assess the maturity of the access. C. To confirm patency and blood flow. D. To determine the appropriate needle gauge. Answer: C. To confirm patency and blood flow. This question highlights a fundamental aspect of vascular access care, asking for the primary reason for a fistula thrill assessment. The thrill, a palpable vibration over the fistula, is caused by turbulent blood flow through the connection between the artery and vein. Assessing the presence and quality of the thrill before each treatment is crucial to confirm that the fistula is open and functioning correctly, patent, with adequate blood flow. A strong, continuous thrill indicates good patency, while a weak, absent, or pulsatile thrill suggests a potential problem like stenosis or thrombosis that needs investigation. While signs of infection and maturity are also important, the thrill specifically confirms ongoing patency. Remember, thrill equals flow, and ensuring good flow is paramount for effective dialysis. Question 12. A patient experiences sudden shortness of breath, chest pain, and a feeling of impending doom during their dialysis treatment. The technician immediately clamps the bloodlines and stops the blood pump. What is the most likely cause of these symptoms? A. Dialysis disequilibrium syndrome. B. Hemolysis. C. Air embolism. D. Hypotension. Answer: C. Air embolism. This question describes a critical emergency during dialysis, and the symptoms of sudden shortness of breath, chest pain, and a feeling of impending doom are classic indicators of an air embolism. An air embolism occurs when air enters the bloodstream and travels to the heart or lungs, leading to severe cardiorespiratory distress. While dialysis disequilibrium syndrome can cause neurological symptoms, and hemolysis involves red blood cell breakdown, and hypotension causes low blood pressure, these symptoms do not typically present with such sudden, severe respiratory and cardiac distress and the specific feeling of impending doom associated with air embolism. Knowing the hallmark signs of an air embolism is crucial for rapid intervention and patient survival. Question 13. Which of the following laboratory values is the best indicator of a patient's overall nutritional status in chronic hemodialysis patients? A. Blood urea nitrogen, BUN. B. Creatinine. C. Serum albumin. D. Hemoglobin. Answer: C. Serum albumin. This question tests your understanding of laboratory indicators in dialysis patients, specifically asking for the best indicator of a patient's overall nutritional status. Serum albumin is a protein synthesized by the liver and is widely recognized as the most reliable indicator of long-term nutritional status and protein intake in dialysis patients. Low albumin levels, hypoalbuminemia, suggest chronic malnutrition, inflammation, or liver dysfunction, all of which are common concerns in this population. While BUN and creatinine reflect kidney function and dialysis adequacy, and hemoglobin indicates anemia, albumin directly reflects protein status. Remember that a healthy albumin level is a good sign the patient is getting enough protein and calories. Question 14. After returning from the dialysis unit, a patient develops chills, fever, and muscle aches. A blood culture later confirms a bloodstream infection. Which of the following is the most likely source of this infection in a dialysis patient? A. Contaminated food. B. Urinary tract infection. C. Vascular access. D. Respiratory infection. Answer: C. Vascular access. This question addresses the significant risk of infection in dialysis patients, with chills, fever, muscle aches, and a bloodstream infection confirmed by culture as key indicators. For hemodialysis patients, the vascular access, e.g., fistula, graft, catheter, is the most common portal of entry for bloodstream infections. Repeated cannulation, compromised skin integrity, and the presence of foreign material, like a catheter, create a direct pathway for bacteria to enter the bloodstream. While other sources of infection are possible, the access site remains the leading cause of sepsis in this population. Proper hand hygiene and diligent access care are the most critical defenses against these dangerous infections. Question 15. The purpose of the ultrafiltration (UF) control system on a hemodialysis machine is to A. Regulate the dialysate flow rate. B. Maintain the patient's electrolyte balance. C. Precisely remove excess fluid from the patient. D. Monitor the blood pump speed. Answer: C. Precisely remove excess fluid from the patient. This question focuses on a core function of the dialysis machine, the ultrafiltration (UF) control system, and asks for its purpose. Ultrafiltration is the process of removing excess fluid from the patient's blood. The UF control system on the hemodialysis machine precisely regulates the amount and rate of fluid removal by controlling the transmembrane pressure across the dialyzer membrane. This ensures that the patient reaches their prescribed dry weight without excessive or insufficient fluid removal, which is critical for patient safety and comfort. While dialysate flow, electrolyte balance, and blood pump speed are all important aspects of dialysis, UF control specifically manages fluid removal. Remember, UF is all about taking off the right amount of water. Question 16. A patient with a newly created AV fistula is having difficulty achieving adequate blood flow during cannulation. The fistula appears well developed and has a good thrill and bruit. What is the most likely cause of the blood flow issue? A. Recirculation within the fistula. B. Venous hypertension. C. Improper needle placement or direction. D. Arterial steal syndrome. Answer: C. Improper needle placement or direction. This question addresses a common challenge with new fistulas and highlights troubleshooting during cannulation, with difficulty achieving adequate blood flow despite a well-developed fistula, good thrill, and bruit as critical clues. If the fistula seems healthy but blood flow is poor, the most likely culprit is a technical issue with cannulation itself. Improper needle placement, e.g., not fully in the vessel lumen, too close to a valve, or pointing against the direction of blood flow, or incorrect angle can significantly impede blood flow into or out of the dialyzer. Recirculation or venous hypertension are typically indicated by other symptoms or machine alarms, and arterial steal syndrome involves distal ischemia. Always reevaluate your cannulation technique and needle position when blood flow is inadequate despite a healthy-looking access. Question 17. The primary reason for monitoring the dialysate temperature is to prevent A. Hemolysis. B. Infection. C. Hypotension. D. Clotting. Answer: A. Hemolysis. This question assesses your knowledge of dialysate parameters and their safety implications, specifically the primary reason for monitoring dialysate temperature. If the dialysate temperature is too high, it can directly damage red blood cells, leading to hemolysis, which is the rupture of red blood cells. Hemolysis can be a serious complication, causing anemia and releasing potassium into the bloodstream. While temperature can indirectly affect patient comfort and blood pressure, its most direct and dangerous effect when too high is the destruction of red blood cells. Always ensure the dialysate temperature is within the safe, prescribed range to protect the patient's blood cells. Question 18. Which of the following actions is essential for a technician to perform immediately after a first-use syndrome reaction is suspected in a patient? A. Increase the dialysate flow rate. B. Administer an antihistamine. C. Discontinue dialysis and notify the nurse. D. Increase the ultrafiltration rate. Answer: C. Discontinue dialysis and notify the nurse. This question focuses on recognizing and responding to a serious patient complication, first-use syndrome, and asks for the essential action. First-use syndrome is an acute, severe hypersensitivity reaction to the dialyzer, characterized by symptoms like chest and back pain, shortness of breath, and hypotension. If suspected, the immediate and critical action is to discontinue dialysis to prevent further exposure to the allergen and immediately notify the nurse or physician for medical management. Administering an antihistamine or adjusting dialysate/UF rates without stopping the treatment would be inappropriate and potentially dangerous. Remember, patient safety always comes first. If a severe reaction is suspected, stop treatment and get medical help. Question 19. What is the recommended frequency for testing the water for total chlorine, chloramine, levels in a dialysis facility? A. Weekly. B. Daily, before each patient shift. C. Every 4 hours. D. At the beginning of each day and every 4 hours thereafter. Answer: D. At the beginning of each day and every 4 hours thereafter. This question tests your critical knowledge of water quality monitoring, specifically the frequency of testing for total chlorine, chloramine levels. According to AAMI, Association for the Advancement of Medical Instrumentation, standards, which guide dialysis facilities, water must be tested for total chlorine at the beginning of each day of patient treatment and then every 4 hours during facility operating hours. This strict schedule is essential because chloramines are highly toxic to dialysis patients and can cause hemolytic anemia, so continuous vigilance is required to ensure their effective removal by the carbon tanks. Consistent and frequent testing is a non-negotiable safety measure in dialysis. Question 20. A patient on hemodialysis reports increasing pain, swelling, and redness over their mature AV fistula, accompanied by a fever. The thrill and bruit are still present. What is the most likely cause of these symptoms? A. Steele syndrome. B. Pseudoaneurysm formation. C. Fistula infection. D. Venous stenosis. Answer: C. Fistula infection. This question describes classic signs of a serious vascular access complication, and the combination of increasing pain, swelling, redness over their mature AV fistula along with fever strongly points to a fistula infection. While Steele syndrome causes distal ischemia, pseudoaneurysm is a localized bulge, and venous stenosis would typically present with poor flow or increased venous pressure. None of these usually involve systemic symptoms like fever and spreading inflammation. Infection can occur even in a well-functioning access and requires immediate medical attention and antibiotic treatment. Always be vigilant for signs of infection at the access site, as it can quickly become life-threatening. Question 21. What is the primary reason for performing a rinseback at the end of a hemodialysis treatment? A. To prevent blood clots in the dialyzer. B. To return the patient's blood from the extracorporeal circuit. C. To flush out any remaining dialysate from the lines. D. To clean the dialyzer for reuse. Answer B. To return the patient's blood from the extracorporeal circuit. This question focuses on a crucial step at the end of every dialysis treatment, the rinseback, and asks for its primary purpose. After the blood has been thoroughly dialyzed, the rinseback procedure involves flushing the extracorporeal circuit, the dialyzer and blood lines, with saline or a saline/blood mixture to return all of the patient's remaining blood from the circuit back into their body. This maximizes the amount of blood returned to the patient, preventing unnecessary blood loss and contributing to better anemia management. Preventing blood clots is an ongoing process with heparin, and flushing dialysate is a minor secondary effect. Remember, rinseback ensures the patient gets all their valuable blood back. Question 22. Which of the following is the most effective method for preventing the spread of infection in a dialysis unit? A. Wearing gloves at all times. B. Routine disinfection of dialysis machines. C. Proper hand hygiene. D. Isolating all patients with known infections. Answer C. Proper hand hygiene. This question addresses a foundational principle of infection control in any healthcare setting, especially a dialysis unit, and asks for the most effective method. While all listed options contribute to infection control, proper hand hygiene, washing hands thoroughly with soap and water or using an alcohol-based hand rub, is universally recognized as the single most effective measure for preventing the spread of healthcare-associated infections. Hands are the primary vehicle for transferring microorganisms, so meticulously clean hands before and after all patient contact, even when wearing gloves, significantly reduces transmission risk. Remember, clean hands save lives and are your first line of defense. Question 23. A patient develops pruritus, itching, that significantly worsens during hemodialysis treatment. Which of the following is the most likely cause in this scenario? A. Hypocalcemia. B. Inadequate phosphorus removal. C. High blood pressure. D. Anemia. Answer B. Inadequate phosphorus removal. This question examines a common and often distressing symptom in dialysis patients, pruritus, itching, and asks for the most likely cause specifically during treatment. Chronic pruritus in dialysis patients is most frequently associated with hyperphosphatemia, meaning high phosphorus levels in the blood, often due to inadequate phosphorus removal during dialysis. The buildup of phosphorus and other uremic toxins can lead to skin irritation. While hypocalcemia can have other symptoms, and high blood pressure or anemia are general dialysis concerns, the connection between itching and phosphorus levels is well established. Always remember that managing phosphorus levels is key to alleviating this uncomfortable symptom for many patients. Question 24. What critical action must a technician take if they observe a large amount of blood rapidly pooling on the floor near a patient's arterial needle site? A. Immediately clamp the venous line. B. Apply direct pressure to the arterial needle site. C. Call for help and prepare for a blood transfusion. D. Increase the blood pump speed to maintain flow. Answer B. Apply direct pressure to the arterial needle site. This question describes a severe and immediate emergency, a large amount of blood rapidly pooling on the floor near a patient's arterial needle site, requiring swift action. In this scenario, the priority is to stop the bleeding. The most effective and immediate action is to apply direct pressure to the bleeding site. This helps to staunch the flow of blood from the arterial axis, which is under higher pressure. While calling for help is also necessary, stopping the immediate blood loss is paramount. Clamping the venous line would not stop arterial bleeding, and increasing the blood pump speed would worsen the bleeding. Remember, in an active bleeding emergency, direct pressure is your first and most critical intervention. Question 25. Which of the following best describes the principle of diffusion in hemodialysis? A. Movement of fluid from an area of lower solute concentration to an area of higher solute concentration. B. Movement of solutes from an area of higher concentration to an area of lower concentration. C. Movement of fluid across a semi-permeable membrane due to hydrostatic pressure. D. Movement of cells across a membrane against a concentration gradient. Answer, B. Movement of solutes from an area of higher concentration to an area of lower concentration. This question tests your fundamental understanding of the core principles of dialysis, specifically diffusion. Diffusion is the passive movement of solutes, like urea, creatinine, and electrolytes, across a semi-permeable membrane, from an area where they are in higher concentration, the patient's blood E, to an area where they are in lower concentration, the dialysate. This process is how waste products are removed from the blood during dialysis. Osmosis involves fluid movement due to solute concentration differences, and ultrafiltration involves fluid movement due to pressure differences. Always remember that diffusion is all about those waste products moving from high to low concentration.